Welcome back to 12 Days in March. Let's begin our analysis of the question options and how they can be used to your advantage. Let's start with an obvious, albeit not always easy principle to follow. If you see the correct answer, pick it and move on. Don't get trapped into overanalyzing incorrect distractors. As I've shown, it is too easy to get tempted or lured away from a correct answer. Don't make life hard for yourself. I know you want to scrutinize all the content, but if the question is a no-brainer or you feel it in your gut, grab the correct answer and move on. Save time, save energy, you'll need it for later in the exam. Okay, let's spend some time dealing with this. The favorite of all student refrains. This one is the award winner. I narrowed it down to 2 choices and always pick the wrong one. The solution to this dilemma is key to your studies and ultimately to the real prize, retention of content. Now pay attention. When you are confronted with a question and all the options look juicy or delicious, stop what you are doing. Did you hear that? Stop what you are doing and think of the typical or key associations for the most likely answer options. The associations don't need to be exhaustive, but should be appropriate to the context, with examples shown. Feel free to pause, but we'll get into the particulars in a moment. But first, I want to link this exercise with my oft-quoted line, take less notes, not more. I'm tying these together by suggesting that the key or typical associations reside in a few short phrases or concepts. Your job in reviewing answer options and revising your notes is to discover the joy of those phrases. That is, you need to boil down concepts to the most quintessential elements. Keep it simple. These are reproducible themes that come up again and again and again within a given topic. It is useful to think about these associations focusing on the classic signs and symptoms while also considering the usual diagnostic test strategies. Simple prompts like these will help you discover how much you already know on any given topic. So here's a nice example. A patient presents with a bleeding disorder. You don't know the answer, but have likely narrowed it down to 2 or 3 choices. If you just briefly list your key associations without further focus on the question stem, the correct answer will often reveal itself. So what are the typical associations? Here, I will share fairly typical responses from students I've worked with. They identify Bernard-Soulier as a platelet disorder, and there is a problem with adherence and, quote, some receptor. When I ask them about testing, they might identify an abnormal bleeding time and/or the ristocetin agglutination test. With von Willebrand disease, they can also identify it as a platelet disorder, they know there's a problem with adherence, and they recall there's something wrong with the factor, perhaps factor 8. With hemophilia, they know there's bleeding and a factor deficiency, and that factor deficiency is usually expressed as an elevation of the PTT. And finally, every student comes up with the quick associations with warfarin. That is, it interferes with the synthesis of vitamin K-dependent clotting factors 10, 9, 7, and 2. Okay, so these are typical student responses. And that's it. All students seem to pull these associations from the recesses of their memory. And now they return to the question stem and the data which was provided. Remember, these students already viewed the data and could not determine the correct response, so I asked them to list those typical associations. Now, when they go back to the stem, after generating those typical associations and diagnostic findings to the best of their abilities, the question gets a whole lot easier. They can associate the prolonged bleeding time with a platelet disorder, and they recognize the prolongation of PTT as a clotting deficiency. So then they are left to choose a disorder that affects both platelet function and the coagulation cascade. In reviewing these options, there is only one disorder that affects both, von Willebrand disease. This example was meant to only illustrate the process as you negotiate through those questions where you narrow it down to 2 choices but can't make the final determination. But there is way more. I also said these exercises are key to getting information into your working memory. So here's how that works. Upon completion of the question, you go back to your notes on von Willebrand disease. You review the language used in the question stem, including the classic data. You pull the relevant points from the stem and answer explanation. You refine your notes. You call out extraneous low-yield material while highlighting the major take-homes for this topic. The combined process of proactively identifying the key associations linked with refinement of your notes is a very effective approach to organizing information into your working memory. This will become clearer when we review Q banks in general. Insofar as refining your notes, here it is. I boil von Willebrand disease down to these few quintessential elements or key sound bites that I'll use to negotiate through future von Willebrand questions or simply when von Willebrand is listed as a distractor. Through repetition of this process, you'll discover how the big-ticket items and/or high-yield information keep recurring. I can guarantee, for example, you will be repeatedly confronted with questions on von Willebrand disease. As topics appear again and again, you'll come to appreciate high-yield from low-yield topics. More importantly, each time you review and refine your von Willebrand notes, focusing on those key associations and the NBME language, it brings the topic that much closer to your fingertips and easy recall on test day. But we're not quite done yet. There's one other key element to your analysis of answer options, especially when you're struggling to select the correct response. In this exercise, as we previously explored with the question stem, you need to focus on what they tell you and what they don't. The information they don't tell you will become an important adjudicator when you narrow it down to two choices. So what does that look like? In this step, you are returning to the stem, perusing what they said, but also what they didn't say. Continuing with this example, let's say you are struggling with hemophilia. You again scour your memories on what you've learned about hemophilia. You know it is associated with bleeding, but what kind of bleeding? Deep tissue bleeding, as in hemarthrosis and/or retroperitoneal bleeding. Neither of these were mentioned in the stem. In the absence of these classic descriptors, it becomes a less likely answer choice. And as previously mentioned, the question writers take some giant leaps of faith. That is, they'll assume the absence of hemarthrosis is enough information for you to exclude hemophilia. And of course, hemophilia doesn't affect the bleeding time, but if you didn't know that, you should have been able to draw other inferences and still get the correct answer. Continuing with this example, it would be a similar process for warfarin. The typical scenarios for warfarin-associated bleeding include access to the medication, an indication for the medication, or the board's favorite, a drug interaction. None of these were described, so I'd be suspicious of warfarin as the correct answer option. Remember, this is an example of a useful technique on questions where you aren't sure of the correct answer. And not to waste the occasion, but where did I come up with those listed associations? These became apparent through the proper analysis of questions in the Q banks. As you scour question stems for the important language and key associations, you will come to observe how patterns form. Your notes and mind frame will morph to reflect what the NBME values as high yield. We'll return to recognizing these patterns during our discussion of the Q banks in general. So this combination of scrutinizing options by their typical associations, including classic signs, symptoms, and diagnostic findings, followed by scrubbing the question stem for what they tell you and what they don't tell you, is often all you need to improve your final answer selection and ultimately your test scores. Through this process, you'll be quite pleased to see how often the correct answer will reveal itself. And don't forget, before you leave the question, be sure to go back and refine your notes with an emphasis on the key sound bites or quintessential elements. I know this sounds arduous, but the more you do it, the better you get at it, and it'll become a self-fulfilling prophecy as you reinforce learning topic by topic. It eventually all comes together. Alright, before moving on, there are a couple of related corollaries. The first one is the sniff test. I don't care if you submit an incorrect answer. That happens, but it better pass the sniff test. Don't be afraid to go back and make sure your answer isn't ridiculous based on the available information. I know this sounds obvious, but I can't tell you how often I prompt a student with a simple phrase, "How does that answer make sense?" And students suddenly realize it couldn't possibly be the correct answer. Make sure your answers pass the sniff test. Similarly, I use the phrase reconcile before submit when uncertainty exists. Before hitting the submit button, scrutinize the stem, including data, for the typical information and associations that you would expect for that answer choice. If you can't find the usual suspects to support your answer, you should probably rethink the answer before hitting submit. From the example already presented, unless I see an elevated PTT, a normal PT, and a history of deep tissue bleeding, it can't be hemophilia. I would need to look for other answer options. And here is a summary of the material we covered on the question options. And with this, let's grab another break before getting into the really important discussion of QBank efficiency and best practices. I know we've presented a lot of information, so if you have any questions or concerns, please email me at 12 days. I should remind you, if this is overwhelming, I do offer one-on-one tutorial sessions on test-taking skills. Details are available at the website.